Hey there, I'm Dr. Casey Green, clinical pharmacist and certified functional medicine practitioner with the Innovation Institute. Today, we're going to cover IV nutritional therapy and specifically the very popular option of high dose vitamin C. So, the number one misconception about high dose vitamin C, what would this be? So, in dealing with hundreds of providers, I've come to realize that most don't understand how high dose vitamin C actually works. So, here I'll cover the number one misconception about high dose vitamin C, and this will make sure that you and your patients get the most possible benefit out of using it. And now I promise I'll get to that in just a minute, but first let's quickly hit on some of the basics just so we have a strong foundation first. So first we'll cover what are the innovation compounding high dose vitamin C protocol kits, which are like all-in-one kits set up with a specific protocol ready to go. Then we'll cover health conditions that might benefit from the use of high dose vitamin C, basic testing and monitoring best practices, how you might customize IV protocols, the single biggest misconception, once again, about high dose vitamin C, and then the 7 most frequently asked questions that I get all the time regarding high dose vitamin C therapy. So why would you use Innovation high dose vitamin C protocol kits? Well, quite simply, they make IV nutrition at your clinic easy, fast, affordable, and effective. They make it very easy to just get up and going very quick with protocols that have already been tested and used tens of thousands of times very safely and very effectively. And they make a very affordable option for you to just jump right in and start helping your patients and making profit right away. So what exactly are they? So again, heavily tested and validated, tens of thousands of uses, come set up to meet various clinical goals right off the bat, and have standardized protocol directions that you just simply have to follow. And then the way they're supplied, they come with vitamin C or ascorbic acid preservative-free vials, which are one-time use vials, but they additionally include supportive electrolytes and multi-dose vials. And we'll get into why those are in there and how they work briefly here. But the kits come with 4 infusions per kit, and again, the standard directions handout. So how are they used? The standard protocol makes it super easy. Just follow directions as far as what to pull up from the individual vials. Ingredient by ingredient, you'll have a list. And then as far as how much carrier solution to mix, one option for that will be in those directions. And then there's other options as well. You can do it standardized per the protocol, or you can even consult the pharmacist with innovation compounding, or look at our clinician's guide for other possible variations on the drip that you can do. So getting started, just are there regulations that I should know? We get these kind of questions all the time. And of course, the answer is yes. And they can be both state and federal. So states can vary significantly depending on where you're at. But I will say this, USP 797 is across the board the standards that are set for sterile compounding, which might not cross over to you as much on the administrative side as far as giving the medications in a medical clinic type of setting. But if your state chooses to, they can enforce these standards, and they're basically set by a group of experts in different areas. So USP would have experts in everything from engineering to pharmaceuticals and all sorts of other areas in between. So they're meant to be a non-biased group that sets just the highest standards. And then again, the states can choose to enforce whether or not they want to, or at the federal level as well. So the big thing is just think in terms of, am I compounding and storing medications, or am I just mixing and administering right away? You really need to be on the side of just mixing and administering right then and there versus storing, because when you get into storing, you get potentially into all the regulations of compounding and assigning new beyond use dates, and it gets much more complicated. So just to protect yourself, again, I would just stay on the side of administration, not heavy duty compounding and storing long term. Do I need a clean room or sterile compounding hood? I would usually say the answer is no, but again, I would refer to your state medical board as far as the best answer goes there, because I'm certainly not a lawyer and we can't say every state by state what is being required. There are definitely differences state by state. But for most clinics I've seen, it's not worth the time and hassle of having a full-blown clean room. It's an extremely expensive startup for one, and it also requires semi-annual recertifications that are thousands of dollars each time. And there's a lot of upkeep and maintenance and paperwork and compliance to deal with making the room compliant and usable. And there might be changes in the upcoming proposed 797 chapter that could help out and clear up some things with the administration side. But again, for now, we would just recommend contacting your local board, see what they best recommend as far as your mixing in the clinic, and just start to familiarize yourself with 797 and what kind of rules you might need to follow there. So how long can the kit be used? So the kit's made up of preservative-free vitamin C vials that are, again, one-time use. So once you puncture those, that's it. They got to be used right then and there. But then the additional electrolytes that are included in multi-dose vials, those have to be used within 28 days from puncture. Those are preserved with benzyl alcohol at 0.9%. And it's USP 797 that recommends using those vials within 28 days from puncture. And that's just because even though they do have preservatives, it minimizes the infection risk since they're being punctured at that point, typically not inside a clean room. So they're technically contaminated. And it's just stating that even though there are preservatives in there, they're not going to hold off the risk of infection forever. So it's best to maintain that less than 28-day rule. So based on that, you generally want to fit all 4 infusions inside a 28-day window. That doesn't apply directly to those preservative-free vitamin C vials because they're once punctured. But as far as those multi-dose vials, once you puncture all of those, they should be used within 28 days. And that's not stability-based. That doesn't mean that the drug is no good per se. That just means that there's a higher risk of infection from that point on. And again, that's based on 797 standards. So which high-dose vitamin C protocol kit should I use? So this is a bit heavier of a topic, but this might give you a little bit of initial guidance. So what I typically see used is the 25 to 50 milligram or 25 to 50 gram protocols being used for the less acute type of health conditions or to assess tolerance when we're getting going. So either for immune support or for the whole like healthy, vibrant skin support, which could even include wound healing, but it could even be mood support, healthy blood pressure support. There are tons of reports and case studies at this point showing that high-dose vitamin C helps with sexual function and sex drive. So those would be the types of things that I'd more commonly see in the 25 to 50 gram dosing range. Then in the higher, the 50 to 100 gram protocol ranges, I more often see those used as like cancer adjunctive support, or like if there's an active infection, like say an actual active case of COVID in your clinic that they want support with. And then the electrolytes are included for a pre-correction. So they're going to be in all the kits. They're not absolutely required, but I'll get into why exactly they're there in more detail a little bit later in the presentation. So what's not included in the kits, just so you make sure you have everything on hand before you schedule an appointment. So the IV carrier fluids, your normal saline, like your ringers, sterile water, whatever's being used, we don't supply those, or the IV lines, syringes, the pumps, or the other related medical supplies. So we only supply the nutrients, the actual drug products that will be put into the bag. So now we'll look at some of the basic health conditions that might benefit from high-dose vitamin C therapy. Some common ones, active viral infection. I've seen it used a lot when there's an active case of COVID, if your clinic actually allows COVID patients in under a protective protocol to try to do a treatment. Of course, is like a cancer adjunctive type of support, immune support, and various anti-aging related types of indications. But I guess the basic way you could think of vitamin C, especially as far as anti-aging and skin support, is if you think back to scurvy, when they discovered that vitamin C was necessary to prevent scurvy, that was the initial proof that it really had not only huge benefit, was actually essential for the health of the skin. So that's kind of where the origins of using it for anti-aging and for skin improvement comes from. Mainly because vitamin C is required for the body to make collagen. So that's how that mechanism works. And so now finally, what you've been waiting for. So the number one misconception about high-dose vitamin C. So many providers try to use high-dose vitamin C to load vitamin C and boost ongoing immunity. but this is actually an incorrect understanding of its mechanism. The mechanism for high-dose vitamin C is actually a complete 180 flip from the mechanism of traditional low-dose vitamin C, which is as an antioxidant. So traditionally, vitamin C is one of the key antioxidants in the body, and everybody knows this. But in using high-dose vitamin C, we're fundamentally changing the role of vitamin C. And we're actually creating an oxidative effect through generation of intracellular hydrogen peroxide. So we're actually turning it into an oxidative therapy instead of an antioxidant therapy. So complete 180 flip. So high-dose vitamin C therapy is not for loading big stores of vitamin C and boosting ongoing immune function. High-dose vitamin C supports an oxidative attack against G6PD deficient cells, such as cancer cells and viruses. And since vitamin C is water soluble, it's cleared from the system very quickly. So even though we're dosing high-dose vitamin C, it's not like we can store up tons of extra vitamin C through a therapy like this. So now on to the basics of testing and monitoring. So what kind should I use? So it's going to be condition and treatment specific, patient specific, but a good general start is to do your CMPs, get that electrolyte status, since that will be affected by high-dose vitamin C treatment. Definitely look at renal function, because we need to be able to clear all of these things properly and control the fluid status with all these fluids coming in. And then just medical assessment for any types of conditions that affect fluid and electrolyte status, like heart failure or renal conditions that cause the body to just not be able to clear things properly or store excess water. And then for high-dose vitamin C specifically, there's something you absolutely must test for initially, and that's for G6PD deficiency. So why would you need to test for G6PD deficiency, and what is this? So this pretty much sums it up here. So high-dose vitamin C is oxidative once again by generating intracellular hydrogen peroxide, as we discussed. So that damages cancer cells and viruses because they're G6PD deficient, which is all good. That's what we're wanting to do. But then our healthy cells need their antioxidant pathway to protect against this hydrogen peroxide surge. And G6PD is what powers this antioxidant pathway via glutathione. So therefore, G6PD deficiency would actually lead to all of the body's cells taking excessive oxidative damage, not just the cancer and viral cells that most people would get the oxidative effect on, which is not good. So to sum up further how this occurs, so G6PD is an enzyme that catalyzes the first step of the pentose phosphate pathway. So this reduces NADP to NADPH, which in turn keeps glutathione in its reduced form where it's ready for its antioxidant activity. So this allows glutathione peroxidase to rid the normal healthy cells of peroxide, which of course is generated in large volume by oxidative high-dose vitamin C. So the immediate effects of strong oxidative therapy in a G6PD deficiency would actually be hemolysis of red blood cells. So the patient might start experiencing redness and edema throughout their body, especially the infusion arm, and then further symptoms like nausea, headache, vomiting, and or dark urine from the rupturing of so many red blood cells. So just ask your lab about testing for G6PD deficiency and what parameters to look for. G6PD is a genetically inherited disorder, and it's most common in males and people of African descent. So not incredibly common in the United States, but should always be initially tested for before giving high-dose vitamin C. So just some common questions here. What is the risk if high-dose vitamin C is infused faster than 4 mL per minute via peripheral line? And the 4 mL per minute, that comes from several leading organizations that recommend no faster than that, just because high-dose vitamin C is a very hypertonic fluid and it's very rough on the peripheral veins where it's being infused. So basically, that means that there's going to be higher risk of adverse events, especially on that peripheral vein that's being used. And that doesn't apply as much if you actually have central line access, but most of our clinicians are not going to have that access. So a peripheral line is going to be needed. And that 4 mL per minute just helps protect the patient's vein, helps prevent them from getting too dehydrated or their electrolytes being thrown off as fast. So there's multiple reasons that it's just safer to keep it below 4 mL per minute. What should the patient have during the high-dose vitamin C infusion? I'll get into what it actually does to their body and how it can cause certain side effects a little further a few slides later. But basically, they need to have water or something to stay hydrated, because even though there's a lot of fluid coming in from this high dose vitamin C infusion, it's going to dehydrate the patient. And that just has to do with the way osmosis works in the body with hypertonic fluid coming into the veins. So the patient will actually need to drink water or some kind of hydrating liquid to offset that dehydrated effect. And it's also good for the patient to have snacks handy, because it can also affect blood sugar as well. And again, I'll cover that more in detail, how that works, in just a few slides. And what should the patient be counseled on regarding post-infusion? Well, they should be told that it can potentially affect their blood pressure and can make them feel dehydrated. So, they could potentially have symptoms of like sweating, low energy, feeling hungry, all those hypoglycemia type of symptoms. So just counsel the patient on what those might look like and what to kind of expect, and to make sure that they snack and keep their blood sugar up and stay hydrated. Now, some basic safety practices. So back to the osmolarity, you always, always, always need to check for osmolarity with no exceptions. You need to know if you're isotonic, hypotonic, hypertonic, and high dose vitamin C is almost always going to be hypertonic, which is essentially means that it's very, very concentrated in a specific way with solute that causes an osmolar effect in the bloodstream as far as how the body is absorbing the water into different tissues. So just know the possible clinical side effects of different agents used. Always do an appropriate medical checkup and know what the patient's renal function and electrolyte status, things like that looks like, as we discussed before. And we always recommend having an emergency crash cart on hand and having advanced cardiac life support training in place and knowing how to use it, because most clinics will never have to use that, especially with these standardized protocols, but you never know when a patient might even just have an allergic reaction or just something beyond your control to one of these drips, or an extreme sensitivity or side effect to something, and you just always want to be ready for those kind of incidents to be able to handle them. So again, the osmolarity of high dose vitamin C, does it tend to be high or low? So it's important to note we've got a resource. It's the osmolarity Excel calculator. So basically it's something you can get from our sales or account team that is an Excel calculator that you can download, and then you can simply put in how many mLs of all the different items that you're inputting into the bag. And so, for example, you could put in 100 mLs of ascorbic acid, and then X number of mLs of all the other ingredients, and in what size and what type of bag, and it will actually calculate what the osmolarity looks like to you and show you how hypertonic it is. So here you can kind of see the ranges. Isotonic, which is basically an osmolarity similar to the blood. So that's your 240 to 375 range. Hypotonic is basically below that. And then hypertonic, so very extra concentrated, that's when you get well beyond, much higher in osmolar concentration to what the blood is, above 375. So, and of course, high dose vitamin C is very hypertonic. In fact, it's extremely hypertonic, and that's why we recommend generally infusing it less than 4 mLs per minute. So customizing high dose vitamin C protocols, can you alter Innovation's protocols? Yes, you can, but if you do alter them, you should still administer as written on the RX. We've found it very beneficial many times and caught many mistakes where it's good to have the pharmacist just looking over things to kind of have your back, really just looking, making sure that there's not a mistake in how something's written, especially if a nurse administering it's not as experienced and doesn't know to catch something. Then our pharmacist, when checking a prescription with the properly written protocol, might be able to catch one of those mistakes that slip by. So you can, of course, do the kits, but with a la carte add-ons as well. You could use lower volumes of different agents if a patient is sensitive to one in particular. I would just check the osmolarity with any changes, just always ensure and document safety. And you can customize drips for further additional benefits or to add other agents for something you're trying to do. But I would just keep in mind that even if they are chemically compatible, you always want to look at the osmolarity. since high dose vitamin C is already extremely dehydrating because of the high osmolarity, if you keep on adding more items, you're just going to further and further dehydrate the patient. So based on this and having the right balance needed, I usually recommend not adding extra items because the dehydration can outweigh the benefits. But it's kind of up to the specific patient scenario and what you're trying to do as a clinician in that specific case. So now we'll look at a case study of a patient getting high dose vitamin C. And in this one, we got a 43-year-old female. She was seeking anti-aging and skin improving options. And so the provider decided to go with high dose vitamin C 25-gram protocol 3 times per week. And this case study looked at a 3-month time period. And so what were the results after the 3 months? Well, the patient reported being very happy with the improvements in her skin, and actually said so much more vibrant and healthy looking. The patient reported significantly improved energy, mood, and sex drive, and wanted to continue on with therapy. So this provider commonly sees results like this and has a lot of patients that continue coming back to get this kind of support from high dose vitamin C. In this case study, a 35-year-old male came in on his first to second day with active COVID-19 infection, wanted to get some immune support to basically try to help get over the infection faster and to feel better. And so it's important to understand the mechanism of high dose vitamin C to understand when it's best used here. So it would not help build up the immune system for future support against infections, but the oxidative therapy of high dose vitamin C can potentially lower current viral loads to support symptomatic relief and quicker recovery. Because remember, viral cells are G6PD deficient, so they can't fight against the oxidative effects of high dose vitamin C like our normal healthy cells in our body can. So he was given 50 grams high dose vitamin C IV daily for 5 days in a row from, again, approximately day 1 or 2 of onset of having COVID. And the result, he reported feeling less symptomatic after even the first infusion, and went from very flu-like on the first day to symptomatically way better and feeling pretty much fully recovered within 3 days. And this clinic, once again, did a lot of treatment like this. You just want to make sure if you are going to have, like, of course, active COVID diagnosed patients in your clinic, that you just have good protocols to make sure infection isn't spread. But this is a good option that can potentially support patients through that. So now with Innovation High Dose Vitamin C Protocol Kits, some frequently asked questions that we get all the time at the pharmacy. So can I mix a Myers or other IV cocktails with high dose vitamin C? So yes, you potentially can, but as mentioned before, the extremely high osmolarity might make the drip so dehydrating that the benefits of the extra vitamins are actually outweighed by the cost. Because if the patient has to urinate so much to clear all the excess fluid, then they might not gain much benefit from those extra vitamins. So my recommendation is typically to give a Myers or other IV cocktail at a different time. Although that's not a hard and fast rule, that's just what I've generally seen to be best practice. So why are magnesium, calcium, and potassium included in Innovation's high dose vitamin C kits? The body sees ascorbic acid like a sugar. So therefore, insulin levels spike, and this drives glucose, magnesium, calcium, and potassium inside the cells. So this can cause temporarily low blood sugar, as well as low magnesium, calcium, and potassium levels in the blood serum, which can make the patient feel just not well at all. So therefore, these minerals are included and dosed appropriately to provide an electrolyte pre-correction that maintains appropriate blood levels and helps the patient to feel better throughout and after the drip the rest of the day. So are they absolutely necessary? No, but they will make the drip much more optimal, and the larger the vitamin C dose that's given, or the more acutely ill the patient is, the more I would definitely recommend ensuring that the minerals are included. So what should I counsel the patient on to expect during and after high dose vitamin C infusions? So the drip will be dehydrating, and it can throw off their blood sugar as well as their blood electrolyte levels temporarily. Therefore, it's best that the patient drink water and stay hydrated. and keep snacks handy to avoid the later low blood sugar symptoms like low energy, anxiety, nervousness, sweating, excessive hunger, etc. So just let the patient know that that's something that's possible, but typically if it's not infused too quickly and the patient stays hydrated and keeps snacks and doesn't let their blood sugar get too low, you typically won't see these issues. Can I use carrier fluids other than sterile water with high dose vitamin C? So first, just let me say, the reason we use sterile water is because it's going to dilute down that very, very high osmolarity as much as possible. And that just makes it more of an optimal drip. But potentially, yes, you can use other carrier fluids with high dose vitamin C, but you'd want to calculate the osmolarity every time and assess its safety. So using normal saline, lactated ringers, D5W, or even half normal saline, those would all increase the osmolarity even further, and thereby they make the drip even harsher on the peripheral infusion vein, and they make it even more dehydrating. So the higher the osmolarity gets, the slower the drip needs to be infused to avoid damage to the peripheral vein. Should I use antioxidant therapy such as glutathione or NAD plus to support on the same day as high dose vitamin C since it's oxidative? While this is controversial, but I would generally advise not giving antioxidant support on the same day, as the purpose is to use the oxidative effect on cells such as cancer cells or viral cells, for example, that are G6PD deficient to create a harsh environment on them. And then the other healthy cells in the body, at least in a patient that is not G6PD deficient, should be able to use their own antioxidant system to neutralize the oxidative effects and protect the healthy cells. Again, though, it's very controversial, but generally I would not recommend it. How often should I give high dose vitamin C infusions? So this will most often be dependent on the limitations set by the patient's availability. But what I generally see practitioners doing is 3 times per week, all the way up to daily as a cancer support type of therapy, or in an active viral infection such as COVID. And that's just to really hit the system hard with that oxidative effect and go after those cells that are G6PD deficient. Or typically I would see 1 to 3 times per week in all other supportive uses. So less frequency could also potentially be helpful on an ongoing maintenance basis. I sometimes see once weekly, even once or twice monthly, as a patient just goes more into maintenance. But initially, in most conditions or most reasons, we would use it 1 to 3 times per week would be pretty typical. Can I use preserved multi-dose ascorbic acid for high-dose vitamin C infusions? No. So preservative-free ascorbic acid must be used at the doses required for oxidative high-dose vitamin C infusions. While benzyl alcohol is normally very safe as a preservative, even in IV medications, the neurotoxic side effect risk is too great to infuse that much benzyl alcohol in 1 day. So the World Health Organization recommends no more than 5 milligrams per kilogram of benzyl alcohol per day. And so, for example, most injectable pharmaceuticals are preserved with 0.9% benzyl alcohol, which is the same as 9 milligrams per ml. So for an easy example, if we say an average patient weighs 154 pounds, which then divided by 2.2 equals 70 kilograms, this means that this patient should not exceed 70 kilograms times 5 milligrams of benzyl alcohol, equaling 350 milligrams of total benzyl alcohol daily. So then if we take that 350 milligram max for that patient, divide it by the 9 milligrams per ml that's in all of these most preserved medications, including ascorbic acid, that would equal 38 mLs of benzyl alcohol preserved liquids that 154-pound patient should not exceed, or probably not even really flirt with, as their daily limit. So there you've got roughly a 150-pound patient, and their limit is about 38 mLs of total preserved solution daily given via IV. So it really makes it just too difficult to do high dose vitamin C at the volumes required to be able to use preserved high dose vitamin C. So based on this, preservative-free ascorbic acid is required when using the large doses used for high dose vitamin C therapy, whereas preserved or multi-dose MDV ascorbic acid can be used in low dose antioxidant based therapy. So well, that's all I've got for you today on high-dose vitamin C. Again, I'm Dr. Casey Green, pharmacist and IFM certified functional medicine practitioner and clinical liaison for innovation compounding. If you've got more questions, feel free to reach out to myself or any pharmacist at Innovation Compounding, and we'd be happy to help you out. Have a great day.
Thank you for listening today. Whether you are looking to expand your practice by adding an IV nutrition therapy segment, or you currently provide IV services and just want a refresher on the topic, this presentation was designed just for you. And education and information training like this is what the Innovation Institute is all about. If you enjoyed this lecture today, I urge you to sign up for future lectures to learn more about the topic. You can do so by going to our website at www.innovationcompounding.com/institute. As always, the pharmacy team at Innovation is here to answer your questions and accept your feedback. So please reach out to us. Thank you again for listening today, and be well.